Hey guys, I'm Dr. Sam, and I'm delighted to be here on Wayne's channel today to help you get closer to great skin days. Now, I have a clinic on Harley Street, I have my own YouTube channel, and through Instagram, I love to share knowledge about getting great skin. So you asked Wayne to answer your questions on a whole variety of things, but what kept coming up was acne, anti-aging, and everything in between. So let's get stuck in. So one of the most popular questions was, how can I manage my hormonal acne, reduce scarring and hyperpigmentation? I've also got the beginning of wrinkles as well. I'm almost 39 years old and still break out like I'm 16. Please help. Okay, Tanya, you are so not alone. This scenario, I would say, is the commonest reason people come into the clinic. And it's also probably the commonest situation that I hear about on social. And I certainly devoted a lot of video content to trying to help people solve this issue. So I think the first thing to say is that acne is not a disease of teenage years. It is common in adulthood. At least 40% of grown-up women will experience some degree of breakouts, whether it's just around their period or it's a more ongoing thing. It's almost as if we were set up to break out. And there's a number of reasons behind that. Sometimes it's down to our skincare practices, and I always look at that as one of the first things when I'm seeing a patient for the first time. Sometimes it's our makeup practices. Sometimes it's down to hormones. So premenstrually, we are, again, set up to break out. At least 70 to 80% of women experience some degree of acne before their period. And we call it physiological acne. It's that common. It's almost normal. But things like contraception can also make us more prone to breaking out. So something that's become very popular is something called the Mirena coil, which is an IUD, which contains a small amount of progestogen. And progestogen is the part of our hormonal cycle that tends to push us towards breaking out. It's why it's so common to get breakouts in the first trimester of pregnancy. And it's also something that can be triggered by the progestogen-only pill. So that's certainly something that's worth thinking about. The other thing that commonly happens is that you may have been on the contraceptive pill, the combined pill, for many years into your 20s, and perhaps after getting married, you're starting to think about having kids, and you stop that combined pill, and acne manifests perhaps for the first time since you were a teenager. Now, it's simply that the combined pill was suppressing it for all those years. So again, it's a common, practically normal thing. But the good news is there's a really structured way to approach it. I'm going to share that with you now. So the first thing is to look at what you're doing with your skincare and make sure that you're set up with your basics. So that means cleanser, moisturizer, and sunscreen so that you're not triggering breakouts with what you're using in the first place. This is terribly common, particularly as people transition into the anti-aging space where a lot of those products are simply not designed not to trigger breakouts. Most of the anti-blemish market is focused on teenage skin, which of course tends to be oilier, but as we get older, we get a little more dry, a little more sensitive, more prone to dehydration. So those sorts of products won't work well, but the anti-aging skincare tends to make you break out. So what do you do? So the key thing is to search out products that are labeled non-comedogenic. And when we developed the Dr. Sam's range, we specifically wanted to make sure that we met the needs of both. So ensuring we didn't trigger breakouts on the one hand, but also provided products that were supportive enough so that you don't dry out when you start to introduce active ingredients. So I think a gentle gel cleanser that washes off, so it's a thorough cleanse, but you get away with one cleanse, is really important. And that's the principle on which we developed Flawless Cleanser. A supportive moisturizer so that you're able to use active ingredients to help fight the acne but not dry out and get peely so that your makeup won't sit properly. And that you're using sunscreen every day because it is the single most important anti-aging tool. But again, sunscreens can break you out, so careful selection to make sure it's non-clogging is really key as well. Plus, make sure you find one that's compatible with your makeup that primes the skin so that you aren't put off wearing it every day because it interferes with the way your makeup sits. Then moving on to makeup. Again, I see a lot of women who are using long wear foundations, setting sprays, a lot of powder to manage T-zone shine, and they're finding that they have to double cleanse to get all of that off their skin. So long wear foundation is just problematic. I've seen too many women over too many years to feel otherwise. And I think it's really important that you develop makeup practices that are compatible with breakout. So that means, again, searching for that term, non-comedogenic. Great brands include NARS, EX1, Armani, and within the Vichy and La Roche-Posay family, because they won't block up your pores. So wearing makeup becomes your friend, not something that's going to continually make matters worse and then aggravate things further because you're having to scrub like crazy to get the stuff off. So that's really key. It's, of course, very important that you have comfort in using makeup. So I'm a big believer in keeping overall base nice and sheer and light, and then just using coverage where you need it. It takes a little bit more time, and I have no doubt Wayne has videos to help you with this, but use higher coverage just where you need it. For women, particularly breakout zones in adulthood tend to be lower face. So lots of your skin will be fine and will be trouble-free. So don't hide the natural good quality parts of your skin by masking it with heavy, high coverage base when you don't need to. Powder, in my experience, tends to also be very clogging, especially again when used in the trouble zone, which is the U of the face. So I would suggest instead seeking out blotting papers and using those to control T-zone shine in combination with matte finish cream products. So coming on to active ingredients and products specifically to treat blemish-prone skin whilst you're anti-aging concerned. Amy Thompson has asked, dry, acne-prone, dull over 40, is there a product to address all of this without layer upon layer of creams, serums, and lotions? If you only had one tried and true product, what would it be? Now, this is a big ask of any one question, and the reason for that is that acne is a multi-step process, and it's a skin disease, which means that in terms of topical ingredients, you often need more than one thing to really get a handle on it. So I like to simplify it by thinking about your anti-inflammatory ingredients, which will calm down the red inflamed spots that might have whiteheads on them, what we call papules and pustules, nodules and cysts. And then we think about prevention, and those are ingredients which will help prevent the pores from getting clogged in the first place. And ingredients that will do that are typically called retinoids. And the other ingredient does that very well is azelaic acid. So anti-inflammatories include salicylic acid, and I look for products that contain 1 to 2%, and benzoyl peroxide. And you don't need to go higher than 2.5 or 5%. I tend to use the anti-inflammatory step in the morning and the prevention step in the nighttime, because retinoids work best at night as they're broken down by daylight UV. So that makes it very simple. Morning is for treating the spots of the here and now, and nighttime is for preventing the spots of the future. And the good news is those ingredients will also help start to work on those pesky dark marks that the old spots have left behind. Now, you asked me about one specific product. I don't think there is one single product. Even in the prescription space, when I'm looking after my patients, I generally give people at least 2 products in terms of their different ways of acting. But I think the best place to start in first line is always your retinoid at night, assuming you're not pregnant, in which case retinoids are not suitable. But for those of you who are suitable for a retinoid, I think that is the place to start. Now, they come in at different price points. At the lower end, you have the Ordinary with their advanced retinoid. We have Flawless Nightly Serum, which is an excellent multitasking retinoid. And then at the higher end, you have Medicate with their products, the Crystal Retinol and Retinol Retinoate. And I think you can find something at every price point. Each has their own individual advantages, and I talk more about this in my retinoid series over on my channel. But I think those are good places to start. In the morning, benzoyl peroxide is relatively limited in availability over the counter, but look to brand Acne side. And then salicylic acid is quite widely available, and Paula's Choice does some of the best products on the market. I hope that helps. Now, staying on this theme, Vic 3176 says, I hit 43 and my skin has suddenly developed every imperfection going. Spots, pigmentation, fine lines, redness, large pores, dark circles. I'm using so many products to try and improve it, but I haven't left it too late. Now, first thing, I suspect, Vix, you are being too hard on yourself. I reckon you have a mirror that you have about here, and you are just thinking about what's wrong with your skin. I bet there's loads that's right. So I encourage people to step away from the mirror and view themselves at conversation distance. And I think this is really important because we are not objective about the way we look at our faces. This is just years upon years of, oh, I wish that was different. I wish that was better. And sometimes there's a period in your life where you just go through a period of negativity towards yourself. Something bad has happened and you focus in on your appearance. So be kind to yourself when you look in the mirror. Imagine you're talking to a dear friend and use that language so that you're always kind of trying to have a balanced view of yourself. So that's the first thing. It's more of a philosophical approach. Secondly, you're kind of coming on to more of the anti-aging aspect. So blemish prone, but still worried about the passage of time and those little changes, fine lines and pores and redness and things. But I think what's really important to know is that most of the really effective ingredients in skincare that work in acne, literally apart from benzoyl peroxide, also have some benefits when it comes to anti-aging. In fact, retinoids are the most robustly supported group of ingredients for anti-aging. Tretinoin, which is what we use in the clinic, is the gold standard for acne and in anti-aging together. So all those other retinoids that are available over the counter related to that molecule, so that's your retinol, retinaldehyde, gram-active retinoid, has a foot in both camps. So you're not sacrificing your anti-aging by treating your acne. So rest assured on that front. One of the ingredients I really like to include in this mix is niacinamide because it's gentle, which is great for that change in barrier function that happens with age, where we get a little drier and a little less tolerant to active ingredients. And that works really well because it's good for pigment, redness, pore clarity, and it boosts barrier function because it increases ceramide content in your skin. So a total winner. And it's even suitable for around the eyes. We actually put it in our moisturizer, sunscreen, and night serum because of that. And it helps you be more tolerant to your retinoids. So literally almost nothing not to like about it. The other active I like is azelaic acid because it's great for acne, it's great for redness, and it's great for pigment. It's also safe in pregnancy. So within that group, you have multiple benefits all working synergistically to really help you tackle kind of all of those key issues. Dark circles are harder. I mean, certainly get your sleep, wear your sunscreen and your sunglasses because this is the thinnest skin and we want to protect it and maintain thickness at all costs. But I'd say take a look again. I'm sure there's lots to like. Think positively and think about making some of those simple, easy steps in your routine. I hope that helps. So just to answer a few more questions on this topic, and I think it is pretty much a video in itself, this topic. Corinne 18 asks, chin acne from hormones, can anything help get rid of it? Basically, as I said before, the U of the face is lady acne zone. So it stops being T and it starts being U. Now it can just be the chin or it can go all the way back to the angle of the jaw. It's obviously hormonal because men don't get this pattern, but it doesn't mean there's anything really wrong with your hormones in the vast majority of instances. So the chin is just where we seem to respond to those changes in hormones the week before our period, but the way we approach treating them is exactly the same. Anti-inflammatories in the morning, retinoids at night. It doesn't mean that I wouldn't use the retinoid all over, but I think it's important to focus in on this with anti-inflammatory steps, so benzoyl peroxide and salicylic acid, so that you know you've got something to tackle any new red bumps when they appear. And for some people, that might mean using those as an ongoing way of suppressing them rather than just waiting to react to them. I mean, I will commonly use a preventative regime with azelaic acid in the morning, a retinoid at night, and then occasional use of benzoyl peroxide. That would tend to be something I would use as a structure in the clinic quite often. But you find out what works for you within those ingredients categories. But those are the places I would start to focus your routine attention on first. retin-a remedy for acne, dealing with just like a teenager, and I'm 33. Also, my pores, Lord, seem to be getting so enlarged. So pores do tend to enlarge as we age. So the two things that make pores bigger, one is oil traffic through them. That happens typically around puberty when our hormones switch on our sebaceous glands. So our pores are really the end of a funnel, and the more traffic through the funnel, the more the pore end looks enlarged. So managing how clear the pores are is important. So things like salicylic acid, which exfoliates the inner part of the pore, niacinamide, and retinoids will help with this. The other thing is that preserving your collagen supplies are vital. So that means daily sunscreen, practicing good sun behavior, which means avoiding strong sunshine, sunbeds, all that sort of stuff. And then actives like retinoids and vitamin C will help preserve the collagen around your pores so they stay upright and perky and not floppy and open. Hope that helps. And then EWPR_M says, I'm over 40 and still watch before these days. I've got acne in just the area of the center of my cheekbones. It's not a matter of the dirty makeup brushes. No, it's not. I agree with you. And in addition, generally my cheeks are not so firm anymore. Any advice? So yes, a lot of people think that acne breakouts hygiene. It's just not that common that's the problem. It's usually with women, as I say, this pattern of acne in the U of the face. And I think there are things that we can do that sometimes make it a little bit worse, whether it's fiddling or, friction with the foam. You can even get acne in context of a helmet strap, for instance. So friction and acne don't go well together. So do be careful that you're not touching your face or fiddling with your blemishes unknowingly. Keep your makeup brushes clean. It's important, of course, but the bacteria that triggers the acne process is on our skin, and it's very hard to eliminate it. So it's not that you're moving anything around with your brushes, as you've rightly pointed out. Firmness, that's all about collagen and elastin. So that's retinoids and sunscreen. And guess what? Your retinoids are the best route to solving your acne. So get that built into your program every day with daily sunscreen, and you should start to see benefits on both fronts. So then coming on to some questions about specifically products in your routine. So a popular question came from Samantha Darbon: how to treat oily but dehydrated skin. Now, dehydration is really a beauty term, because unless you have a skin disorder like eczema or rosacea, where your skin barrier is naturally dysfunctional, most of the dehydration comes from what we do to our skin. A lot of us are just doing too much. So if I think that somebody has fundamentally got oily skin, and actually it's relatively rare to have what I would call completely oily skin, the vast majority of it has actually got combination skin where it's oily here, but normal or even dry and sensitive on the cheeks. I mean, that accounts for about 60 to 65% of individuals in adulthood. Then I think that is where the challenge comes, because we want to manage the oil here, but products that are good for oily skin are often drying for skin here. So I think that's probably what you mean. Now, I think that on the whole, if we have made our skin perform well, it's bright, it's luminous, it's even tone, we've minimized redness, a little bit of shine matters a lot less. And oftentimes the problem with oiliness in the T-zone comes as a hangover from breakouts where that oil meant greasy. So that's the first thing. I would really look at yourself critically. Are you judging your little bit of shine that's built in a little too harshly? So think of it first. Then I would suggest that you look at how you're cleansing, because a lot of people are making the error of using foaming cleansers to tackle this at the expense of this. And I firmly believe that almost everyone benefits from gentle cleansing without foam. Then I think you could look at targeted treatment of an oily area like the T-zone with salicylic acid, and something like Paula's Choice BHA solution is a good way of doing that, but avoiding using product on areas that don't need that activity. Then use a supportive moisturizer, perhaps with niacinamide, like Flawless Moisturizer, so that you're getting that pore clarity, but you're also supporting your barrier so you have healthy, hydrated, glowing skin all over. Then with your cosmetics and your sunscreen, look for matte formulations if that's your vibe. If you prefer your skin not to be on the overly dewy front, that's how I'd recommend you move forward. Next question from Cooley Kathy. What's the number one ingredient we should avoid? Now, that's a pretty big ask actually, but I think I'm going to go for fragrance. Literally no place for fragrance in skincare, in my opinion. You can make products that are unfragranced. I know because I've done it. It takes a bit more effort, but it's worth it because fragrance does not serve any purpose for your skin. You're definitely treating your brain when you seek out fragrance skincare. And guess what? You can burn a candle or spritz a room spray, or put your perfume on so you have that fresh scent whilst you're doing your skincare. But it has no place. It's irritant. It takes up room that could be otherwise used to introduce active ingredients that really will make a big difference to your complexion. So take my advice and seek out products without fragrance. Now, Amber Chelsea Lewis asks, is it appropriate to apply coconut oil 2 times a day to oily prone skin? Now, oils, not a category of skincare that I have any passion for. I think they largely cause problems. And in particular, coconut oil is one of the biggest culprits. I think that there's a lot of mythology out there that if you apply oils to your skin, you switch off the oil mechanism of production within the skin, and it's total nonsense. There is no feedback loop for that in the skin. But coconut oil specifically in oily skin is high risk for breakouts. Coconut oil can be highly comedogenic in skin, meaning can really block pores. We see that a lot along the hairline and temples in individuals who are using it on their hair because it's fashionable right now. But in my mind, it's an absolute no-no if you're oily or acne prone. Now, Zally Beauty says, how come acne leaves me the scars even though I don't pop them? Every acne leaves me a scar. Now, first thing, the distinction between a pigmentation mark, which is flat, what we call PIH, post-inflammatory hyperpigmentation, and a scar, which in medical terms is where there's an actual indentation being created, which can happen with acne, particularly if it's deep in the dermis and the spots are grumbling on for a long period of time. And some individuals are just more prone to scarring because of their healing mechanisms, their genetics. If it's a true scar, I think that is a reason to go and see a medical professional ASAP, because that is an emergency. That is a permanent thing in your skin for many and requires urgent intervention to control the acne process in the first place to reduce the risk of new scars from happening. And you may well need treatment for the existing scars that you have from previous blemishes. So don't suffer unnecessarily. This is something to take seriously and you should get help for that. However, if it is simply a question of post-inflammatory hyperpigmentation, which are the flat red marks, the good news is those will improve with time. Again, still really important to get a handle on the acne process, but things like retinoids, azelaic acid, sun protection, and even alpha hydroxy acids will encourage the skin to eliminate that pigment, and in time, you should get back to an even toned complexion. So I really enjoyed doing this video for you, and if you want more information on retinoids, because I talked about those a lot, do head over to my channel to watch the retinoid series. And I've also done a step-by-step guide to managing your acne, which you can start at home and give a chance to work for your skin. And know that if that's not winning, you may well need to go and see a doctor about your skin. So don't hesitate to do that. Acne causes so much misery and there's no need to suffer. So a big thank you to Wayne for inviting me on his channel today. And if you liked it, please let us know in the comments and give it a thumbs up, and I'll come back and do another one again soon. Bye for now.